first, I'll start off by saying that, and most people are aware that as the term suggests, spectrum means that there is substantial variability in the clinical presentation of autism, ranging from individuals on the spectrum who have high support needs because they are significantly impaired, ranging to individuals who have lower support needs because they have stronger skills in speech and language or, in cognition. So, just like all children, each child on the autism spectrum is unique. But having said that, my colleagues and I have noticed in our clinic that on average, boys with autism tend to have more what we call externalizing symptoms or disruptive behavior. So, examples would include things like hyperactivity and aggression. And that you can imagine would garner more attention from parents, from other caregivers, from daycare providers, teachers, primary care, providers. So girls with autism tend to be quieter. And again, this is not across the board, but on average. And so they might not attract as much attention from adults. And there are studies that have shown that girls tend not to have, for example, as many repetitive behaviors as boys. And that's one of the important features of autism that we look for when we're doing an evaluation. They might have less obsessive interests, or their preoccupations might seem less odd. So I remember clearly a boy in clinic who was obsessed with batteries, which seems a bit of an odd preoccupation, whereas I've met girls who are obsessed with collecting pencils, which might not seem as odd. And they are, tend to more likely mimic other children in social situations and try to fit in. So they might seem milder or less obvious than boys with autism. And therefore, as I said, not attract as much attention.